Friends, in last video we discussed about vertigo and its causes. Today we shall see when should one go to a doctor, what your doctor is likely to do, and what tips you can follow to minimize the intensity of your vertigo. I am Dr. Prasad, Honap, a consulting physician, and you are watching Let's Talk About Wellness. Each episode of vertigo needs to be investigated by a consultant. So you should go to a doctor, especially when you have symptoms like difficulty in swallowing, problem with movement of eyes, facial paralysis, slurred speech, and weakness of the limbs. Treatment for vertigo. Treatment for vertigo depends on what is causing vertigo. In many cases, vertigo goes away without any treatment. This is because your brain is able to adapt, at least in part, to the inner ear changes, relying on other mechanisms to maintain balance. Some of the treatments that your doctor may advise include what is known as canalith repositioning maneuver or Epley's maneuver. When your doctor is performing Epley's maneuver, he will tell you to sit on a chair and will secure in such a way that you do not fall when the chair is turned in different directions. The movements are done to move the calcium deposits out of the canals into the inner ear chamber so that they can be absorbed by the body. You will likely have vertigo symptoms during this procedure, and as soon as canaliths go to their proper position, the vertigo will just disappear. In some cases, your doctor may give you medication to relieve symptoms such as nausea or motion sickness. If vertigo is caused by an infection or inflammation, antibiotics and steroids may reduce swelling and cure the infection. For Meniere's disease, he may give you water pills, which may be prescribed to reduce the pressure from the fluid built up. And in very few cases, your doctor may advise surgery. If the vertigo is caused by more serious underlying problems such as tumor or injury to the brain or neck, treatment of those problems may help to alleviate the vertigo. What can you do to reduce the intensity of symptoms during an episode of vertigo? You can try some of these tips. When you have an episode of vertigo, don't make any sudden movements with your neck or with your body. Try to sit still or lie down. This may reduce the intensity of symptoms. When you are lying down, get up very slowly and resume activity gradually. Avoid reading or watching TV, and even avoid looking at your mobile phone when you are having an episode of vertigo. Don't look at bright lights or don't look at the flashing lights such as neon signs on the road, because that is a trigger for an episode of vertigo. One thing you must definitely observe is to avoid driving absolutely when you have vertigo. Don't even operate heavy machinery or don't do anything that needs precision movements. Friends, most of the times vertigo is not a serious problem, but let your doctor decide that. I am sure this video will help you or guide you to manage your vertigo if you have one. Thank you very much.